You can find Hello Vanessa Media, this content on Rumble, YouTube, all podcasting platforms, LinkedIn. Check out hellovanessamedia.com and check out store.hellovanessamedia.com. Hi, my name is Vanessa Lech, and today's video is going to be about this new survey about women, specifically childcare, but it was aimed at women in particular through the Veterans Affairs Organization, essentially. So I'm going to cover that. I'm also going to take a moment to cover some topics directly related to this topic of women and the U.S. Department of Veterans Affairs, specifically Veterans Health Administration, which is something I have so many comments on these days. I swear I do. Okay, so let's get started. So as you'll see right here, the survey, this is what popped up. I took a screenshot. It says, help VA understand what veterans need for childcare. Please take this 2-minute survey to help us understand veteran childcare needs. Begin survey. It has a little red button. You click on it. And so I'm also reading this for the people that are listening to the podcast and can't actually see the video. So this was a really quick survey. It was definitely took me less than 2 minutes to complete it. I discovered it through the email newsletter that comes out from the U.S. Department of Veterans Affairs on, it feels like a weekly basis, but I'm not quite sure how often because I'm not timing it out. It's an interesting newsletter that typically is chock full of things I am interested in some way, shape, or form. And this happened to be one of the things. And I'm all about surveys. And if you've noticed, you'll have noticed I'm all about VA surveys if you watch my YouTube channel, Rumble channel, listen to my podcast, because I seem to be like the survey queen. I just always cover them because it's a topic of interest for me. Anyways, so here it is. It says the question about childcare. We want to hear about your childcare needs when attending a medical appointment at a VHA, Veterans Health Administration facility. All right. And the question is, do you have a child or children that need care when you attend medical appointments? This includes child or children whom you are a caretaker, for example, a grandparent or relative. Okay. And then just a simple yes or no, and then that is it. And then it has a button where you click finish, and then you go on to next. And it says, thanks you for choosing VA. And that is the exact same closing page that I have seen on every single VA survey thus far. So I do have a lot of commentary, though. It mentions the Women's Veterans Call Center right here, as you'll see in that logo. And this is actually a hotline or whatever you want to call it that I have direct experience with. I've called them, I think, 3 times, but I could be off on that. I forget, but approximately 3 times, okay, over a period of months. Basically, the line is supposed to be for women veterans to obtain information or to be connected to, you name it, that they can facilitate potentially. And my direct experience was that the people on the line were nice and everything to me and never had any problems with them being mean or rude or anything like that. However, and I do believe that they did their job, by the way, I do believe they try to communicate the information to the people it needed to be communicated to. However, the people on the ground, so to speak, they're supposed to be doing their jobs and connecting, basically, chose not to do it or didn't do it or whatever the case. The message fell flat. And the reason that I haven't gotten as far as I have is because I've advocated for myself. No one else has advocated for me at the end of the day with regards to Veterans Health Administration. And if you watch my videos, listen to my podcast, you'll know all about that. I share about that to some extent. So I find that the women veteran issue is a real propaganda tool that the VHA loves to really harp on and talk about how they take care of their female veterans. I would really strongly disagree with that. I feel really the VHA at this point is lagging the furthest behind of all of the wings, if you will, of the U.S. Department of Veterans Affairs. And in my view, the wings are Veterans Health Administration, VHA, Veterans Benefits Administration, VBA, and the Cemetery Division. Those are the 3 that I have been familiar with for 10 years now, okay? Now, they've added different wings that they consider, but I'm really not familiar if they have extra arms. I know there's a lot that's been added. I just don't know if it's considered like an actual arm division of the organization or not. I don't know if it's extended that far. So anyways, but the Women veteran propaganda is what I would call it, is something that is constant with the Veterans Health Administration, and it really ticks me off. Okay. Because the propaganda just doesn't match reality. Once again, I complain about this quite a lot with regard to Veterans Administration in general. And there's a lot of money being spent, and I just believe they need to shut down the women's hotline altogether and shut down these women's program managers, because I've had direct experience between working at the organization, Veterans Health Administration, years ago, and being a patient now currently. And I just think it is a total and complete waste of money. I believe that the money from the women's hotline and the women's program manager needs to be diverted immediately to quality healthcare services for military veterans that are in line with the military veterans' choices, preferences, and values. Okay, that could be like faith-based, for example. That's just one of many examples. Because currently there's a lack of focus on what the military veteran wants and needs versus the propaganda that's being pushed out and how it makes the Veterans Health Administration and certain leaders appear. Currently at the Alexandria, Louisiana Veterans Affairs Medical Center, the women's department, which I have been in and had one appointment at, has one primary care provider, which I was not impressed with. And that's why they're not my provider anymore. And the wing where it's at just kind of looks a bit neglected and dated. And there's a ton of administrative support staff, like administrative assistant, nursing assistant, nurse type people. But there's only one primary care provider the last time I was there, which was in the last, few months. Previously, they had two for a brief period of time, and that was my primary care provider from a different clinic, a community-based outpatient clinic, CBOC, that was located in Fort Polk, Louisiana. Okay. And that person quit that clinic, went to the women's clinic in Alexandria, Louisiana Veterans Affairs Medical Center, quit that clinic after a brief period of time, a number of months. And I don't know if they're with the VA anymore or not. I'm not quite sure. In my interview with Dwayne Kimball, we kind of talk about that briefly, about how there was like an interruption in my routine care because of the staff turnover and retention issues, which is very prevalent in Veterans Health Administration. And I've detailed this quite a lot in my other videos and podcasts, where Congress has actually gotten involved and they've noticed the issues because they're so significant and obvious. And of course, Veterans Health Administration leadership just totally denied it. And we're like, we're in line with, the civilian non-governmental sector and like the industry standard. And I would say probably not true. Okay. So the Veterans Health Administration has a reputation that absolutely precedes it in certain circles, to include healthcare professional circles. This I know to be true. All right. So that's just the reality of it. Anyway, so that is about it for this video. Don't want to get too long-winded on this one. So if you have experience as with the Women's Veterans Hotline, and you'd like to share it, feel free. If you have experience with women's program manager and you'd like to share it, feel free. If you have any thoughts on this matter about that type of stuff, you can drop a comment in the YouTube comment section, and the Rumble comment section. You can leave a voice message for the podcast. And you can also support this content if you're so inclined to do so by checking out the information in the description below. You can go to store.hellovanessamedia.com. You can go to hellovanessamedia.com and look at the ways to support section as well. I've got it all covered and laid out to try to make this a sustainable content creation situation. All right. I wish you all the best, and I hope you have a great day. Bye. You can find this content on Rumble, YouTube, all podcasting platforms, LinkedIn, hellovanessamedia.com, and don't forget to check out store.hellovanessamedia.com.